being find jobs, and what do you think we need out here? We need that. We need that. So I don't want to use that as an excuse. Like, oh no, no, no. We need to. That's just. It was put in front of us. I seen it. Now you can partake upon that, and it can take away. It can take away. To me, it can make you more ghetto.
Yeah. Well, here's my point too: is that I think Africans in America have played the cards they've been dealt, and we have generational families that, if not for those very, very foundational, strong black people, we would not be here. And but I think that, and I come to mind about these Pearson and Jones, these two young African American legislators that were expelled from the legislature because they were protesting gun violence. Now, some would say, is this new? No, it's not new. It happened in the 1800s. And it's been a consistent issue whenever men of color have ascended to some minimum power. It's always an issue.
Yes.
Always an issue.
Always.
And I think that
and education is anywhere. It's in being a doctor, it's being a lawyer, it's being any place in a position of doing something they want to discredit what you're about, and that's not. That's I've seen it through doctors and lawyers. I wonder how to get through it, and just like man, the courage you got to go every day and listen to what people say about you. You qualified to do this, but because of your skin color or what they feel about you, that when they try to belittle you.
And I think too is that what I've tried to do in this program is kind of have people understand the historical and political context by which we are number one, number two in prostate cancer. It's not we woke up and said, "Gee, I want to have prostate cancer." Excuse me. I could literally say, coming from the womb of a black mother, puts you at risk for prostate cancer.
Oh yeah.
And so if it starts from just being born, then everything else is a sidebar, or then because all the things we want to do, the red meat, the sugar, the fat, that's all the fun stuff. But in reality, it's the killer stuff, and particularly for us.
Oh, 110%. I was just thinking about that. My mother working all the time and just come in and we do a TV dinner.
Oh, yeah.
Or something like that.
Yeah.
What I'm saying?
Yeah.
So
oh, yeah. And the aluminum foil.
So I can't sit up here and be. I thought about it, and I was like, okay, it had to be like a lifetime of things, Barry. It's like you have to. A friend of mine, he's a vegan, and that's part of what they was taught. He grew up like that,
Right.
And so he never ate burgers. He never ate none of that stuff. He was, and so
even if he got cancer, it'd be a less lethal cancer. They could treat it quicker. It'd be more able to be, put into remission.
Yeah. So when he told me I have 4, I'm like, what is 4? And so, I started doing my research on what it is, like, oh, that's it. And I got metastatic.
Well, I mean, it's when, like, for the prostate, a lot more cancer is found in the prostate than normal. And so you get to that point where, if you make the prostate to a pie, maybe you've got 3/4 of your pie full, maybe even a little bit more.
Oh yeah, I put that up in there talking about the stages of prostate cancer.
So tell us a little bit about your. This is something you can go to the website, go and find.
This is like my pitch deck when I send it out to people who we are and what we're trying to do. It tells you who we are, what we're trying to do.
And this is the baseline. Say it for me. Baseline.
Cancer Awareness Foundation.
Baseline Cancer Wellness Foundation.
And signs and symptoms you may have if you frequently go into the restroom. Like one of the guys in one of our groups, he plays sports. He was like, he drank a lot of water. He thought just going to the bathroom and then drink a lot of water, and he ends up going to the doctor. He found out he got prostate cancer. He's like, well, like how? what? So it's like really a shock. You can be in the best
Well,
shape
yeah.
and still
Oh,
it does
true. It's silent.
yeah, it's
It really
silent.
is silent. It's
It
not painful. I
no
don't think people talk about pain. They talk about urgency, frequency
no
symptoms.
I thought about it.
Something
You
like
start
that.
having hip problems. You will
Yeah,
start hamstring problems,
yeah.
groin problems, stuff
Because the
like that.
cancer is moving.
Yeah.
Yeah.
So I was having that at the early stage, like 30 though,
Yeah.
and I didn't know.
But again, this is a discussion around us and our bodies and who we are, and you know, on a discussion, you come in at 30, say you got hip pain. Oh, you want drugs?
Yeah, that's the
No,
first thing they always think too.
no.
They
I
would,
have hip pain. I'd like to find out what the problem is.
yeah,
But again, it's that institutional, structural racism and just fair. I say Western medicine has a problem with communicating with people that they don't like or respect or love. So, in other words, I really do feel that a part of our lack of care is the inability for that person that's seeing him or her to relate to that person as a person
yes,
and not look at that person as three-fifths of a human being.
yes. That's
Yeah.
and that's fine. That's finding a doctor you can trust, and you can interview a doctor just the way you interview anybody else to see if they have your best interests at heart. You don't have to just go with them. And so that's what we got to learn how to advocate and have somebody there with us to like, do you feel that vibe or whatever? If you don't feel comfortable, then you can go on to find somebody else. You're paying for your health care coverage, whatever. So why can't you find what you need to get what you want? It's no excuses for that. If you're paying for it, you got to.
Well, and speaking of advocacy, tomorrow will be April 16th. And in 1963, Martin Luther King uh, provided us with another major document, his letter from Birmingham jail. And it's a real crucial document in the civil rights movement. And he was arrested and imprisoned in Birmingham for his involvement in peaceful protests. So I brought that up as a parallel to these young brothers in Tennessee. The same thing happened. Well, not in prison, but expelled from their elected posts. So this is nothing that did not always happen. And I think what's significant for you, let's see if I can find it, is that this is a document that Dr. King wrote again while he was incarcerated. And I kind of think about what you were saying. And he says that while confined here in the Birmingham City Jail, I came across your recent statement calling my present activities unwise and untimely. Seldom do I pause to answer criticism of my work and ideas, and if I had sought to answer all the criticism across my desk, my secretaries would have little time for anything else. You have to go with what you're doing.
Yes.
And you have to go against the common grain, which is what he always did. And so, as you continue to push this prostate cancer piece forward, um, um, folks like Dr. Frank Staggers, one of my elders who's now passed, talked about the global treatment of African American men and particularly prostate cancer.
Oh, definitely.
Yeah, yeah, yeah.
I'm just trying to tap into resources that I know. And when I do, a lot of them don't even know about prostate cancer, or a lot of people thinking they get that prostate cancer test, you're not even getting that test. So it's just educating people on. Uh,
And then you need to have another type of testing that doesn't require that you do blood testing. That would be a real
the only one that
expanded
you do the
piece.
finger in your butt, or
Yeah,
you do that because when he did that, he said, "Oh yeah, you gotta go
yeah.
in."
I mean, again, this is the kind of things that happen. Again, we have rectal fear.
It don't matter.
Rectal preoccupation
Women have to
fear.
people. Women have to go get checked out when they go through there. So it's the same thing with us.
But again, when you're not taught that, when that's not a part of what you do, and even in white male culture, which should be the standard, they have an issue with it. I know because I take care of everybody. So there's always an issue when they say, "Well, how are you? You in 40s? Saying any prostate cancer issue? Well, my daddy can let's do exam. I don't do
But
exam."
that's why we need to have somebody there with us. I
Uh-huh.
went to the doctor, my father, and I seen how he act. He's a little older, and I was like, look, you can't act like that.
But yeah,
You have to let them get their blood work done. Let them do the basic stuff they got to do, and so let them run them tests for.
and I hear you, and I'm a clinician, but I get it. After all these years, I get why having to deal with so many. It's another. It's kind of like you die by 1,000 cuts. So this is another cut that you have to subject yourself to when you go to a provider and you have to pull your pants down and bend over. But understanding that bending over could save your life and maintain or help you maintain the quality of your life, that's not explained.
That's why we need to go with people
Yeah.
that can help us explain that.
Yeah.
While we sitting in there like, yo, this is why you're doing that, and if somebody else been in that situation before, they can explain, hey, this is what's going to happen, and we need to educate. That's why we need to the younger generation need to listen to what the older generation is saying, because they telling us that. But if we just want to run around the streets and be out there doing that, you got a window of time. You can't do what you did at 20, all the way 30 and 40. Your body's going to shut down. Some stuff is going to start happening. You do keep doing drugs and alcohol from 20 to 20 years of drug. Who can work that long? Your body can't function. You're going to have heart, liver disease. It's something.
Something gonna happen.
Smoking cigarette, you're going to get emphysema. It's something that's going to happen to you. You have to change. You know what I'm saying? And if your friend is your friend, then go to the doctor with me. I don't want to go shopping with you. I don't want to go eat lunch with you. Go to the doctor with me.
Well,
And we got fake friends out here. You know what I'm saying? We got people want to go on vacation getting killed, or we got different needs of that nature. So we do we really got good friends?
well, and I think too that
Cause you cut your real friends on your hand.
true. I think that part of these conversations is to get men and family members, particularly men, to think about their health and think about the quality of their health and uh, what promotes longevity, what promotes quality of life. Because you can live a long time, but it's the quality of life that I think people want
They
to
don't
pursue.
understand that, and I just see people like I just work till I pass out. I'm like, what okay, dude? You just the stuff you're working for, it means nothing. The people that don't want to do your business,
But
what you was doing.
I talked about it last week. We have a plantation mentality,
Yeah.
and unfortunately, that's the weight of being 20 people that land on this continent in 1619. And we never had and you can go back and I can see them, to those men and women that worked 7 days a week. They didn't know what a day off was, and when they took a day off, they felt uncomfortable doing it.
Mm-hmm.
So if you're uncomfortable taking a vacation, you're definitely uncomfortable with going to get examined and being told that you need to change your behavior in some way or not. So this is all part of it, because
But we need those groups. That's why the men's group is very important, because you hear other men saying that older men will speak, and you listen to them talk, and you're like, okay, I need to start changing up if I want to get there. And so we need to have these men groups more often, where we can have people talking about health. Everybody want to talk about finance and this and that. Dude, you're not even gonna get to that point because you don't even know how to live right. You know what I'm saying? Everybody want to do a finance group or this and make money doing this and that. It's like, dude, we need to learn how. Can you just show me how to cook a weekly meal without no meat in it?
Well, and here's the discussion too. I was again, I'm in a community practice, and I've just been seeing a lot of high blood pressure. I mean, uncontrolled high blood pressure. I mean, and I think over my 30-year period, I'd see sometimes with a number of high, but it just seems like every other person I was seeing, that blood pressure was out of control.
Yeah.
And the reason why that's important because increased blood pressure problems make prostate cancer worse. So, because you got to treat two things. So, my point is that you were talking about food choices and diet and the discussion around, part of this is a lifestyle choices, blood sugar, being overweight, eating unhealthy diet, and whatever. What an unhealthy diet mean? Probably we could talk about, but usually it's high in fat, high in salt, high in sugar, and it negates a level of activity at least 30 minutes a day for at least 4 days out of the week. So if we're not doing that, it's almost like we came off the plantation and decided that we didn't have to do anything, and that's what we did. And so now we're dying just like the ex-plantation owner. Heart disease is the number one killer of Americans. Simple as that. And then when you add on, prostate cancer, God, you add on cancer, and then you add on prostate cancer. And why this conversation is important, because those men are usually silent, because it's not hurting them. Yeah. They're not complaining of anything. They may have some weight loss, may have some bone pain, but ain't nothing really going on.
That's why when I what I really noticed, I went to the dentist and the dentist looked at me and said, "Are you okay?" And I was like, "What you mean?" I was like, "Pandemic, I lost the weight." He was like, "No, are you okay?" And I was like, "Yeah." I was like, "The pandemic." He was like, "No, are you okay?" And as soon as he said it the third time, I was looking like, "Oh, I must not look good." And that's when I started happening. I took a picture like this last picture on there. I was like 165.
Oh wow!
I was 165, and then the next one when I started getting treatment. Wow. I got up to 220.
That's a trip.
And so people just thought I was always skinny.
Wow, that's a trip. That is a cold-blooded trip.
So you have people be around you and they still don't even know you're sick.
Give me a second. I think. Give me a second here. I guess. All right. Well, let's go. So it's been a great show. We've got about another um, 15 minutes, and I want to kind of make sure we got everything in regards to organizationally, you, and what do you see for the future?
Growing this, getting out and just working with a lot of different people. I work with different organizations as we know right now, just tapping into it. I just finished up the website. Trying to get out here to work with some athletes. Like I said, I want to get out there, talk to kids, work with some schools. I want to, the same way you see the pink, I want to see the blue.
Okay, I get it. All right.
Same way.
So is blue the color for
yes,
prostate
sir.
cancer?
Yes, sir.
Okay, blue.
Baby blue.
Okay, we're blue.
Yeah, baby
all
blue.
Right.
And so I want to just the same thing you see the pink. I want to do the blue. Baseball does a little bit. I've seen football. They did, I think, with the tackle cancer, but they do all the different cancers all together.
Oh, okay.
And so, but they don't really, like 74% of men that get prostate cancer are African American men.
Of course.
1 out of 8 men get it, but 2 out of those 8 men are African American men that's going to get prostate cancer, which they don't talk about. Like I say, we got to watch our diet. We got to speak to one another. We got to watch.
Yeah, it's usually again high in salt, high in sugar, high in processed.
Yeah.
What I see the flip side of alcohol use is the sugar use. So that's one thing that just have to be mindful, because they both are sugar kind of substances. And so when most folks that I'm talking to, and myself, have stopped drinking and doing more sugar foods, they have to watch those. You just have to watch more. It has to be plant based. Lots of water, less sodas.
Yes, fresh juices.
Your fresh juices. And activity.
So you got to exercise. Exercise again. You got to stay around positivity. You can't put yourself up under stress. If you know stress coming to you, but you're gonna put yourself up under that stress to cause yourself stress by drinking, alcohol, drugs, gambling, however you gonna add more stress. That's not excitement to my life.
Right.
More trauma. More trauma to my life. I don't need that.
Yeah. And I think that one of the things too is that we're so used to dying young, we've forgotten and we don't really understand how to live.
Oh man, I'm sitting
You
there trying
know,
to say I'm trying to get to my father age 74.
yeah, yeah, and I
We
think
don't know
that
how to live.
too often the older men in my life uh, were dying what I thought to be quicker than what they should have been, and they were. And I didn't really understand that. I just thought it was just what happened,
Yeah,
you know.
me
And
too.
again, I think it's a concert of things that happen for us not to. Um, there's a concert of things that happen for us to be here talking about this and having black men, African American men being number two. Um, that just didn't happen. Some of these things I think are designed, environmentally. Now
Oh,
we,
look, I've seen it. I've
yeah,
seen it. I've seen it literally change Oakland. I've seen we had businesses that was up on East 14. We used to go up there from our school to go to the print shops and the different black businesses, talk about what you can do and stuff like that. I've seen when the drugs hit and how it changed all the businesses wiped out and people can't
drugs
go
and
free.
guns, guns and drugs.
Yeah, and I
You
seen
know,
it. The prostitution. It was in my family. It's the whole thing.
well, I think too is that the effects of chattel slavery have had a profound effect on Africans in America, those that have survived the 1619 uh, um, and brought us to
I feel like
2023.
this. My great grandmother was born on a plantation. She did sharecropping, and then my grandmother came to California. Everybody moved out here after she came, and she
Mm-hmm.
started doing various jobs and stuff like that. And so it ain't like I'm that far removed. I mean, they was born on a plantation.
Right.
You know,
Yeah.
and they
Well,
and her mother was was killed when they was younger. So it's like
like trauma.
trauma. It's
Yeah. And
and,
so
and
I,
there's no family
you know,
going through it.
and it's not. I'm not just talking about the substance issues. Also, I'm talking about the psychosocial issues of waking up every morning feeling like there's a target on your back.
Yep.
You know, and so that's the piece that involves in degrades our health. And you know, I get constant discussions from colleagues about how I relate to people and why I try to relate to people because everyone has a story to tell. If I'm here to help you, I need to know what your story is.
Yes. Everybody has a story.
So and I have to be willing to listen to that story. So the other piece to the prostate cancer speak is that you can't do some things in 15 minutes.
No, it's not.
So
No,
the
no.
discussion around how the even the healthcare vision is structured, so it promotes you bleeding. It doesn't promote you having a conversation. It doesn't promote your authenticity. It doesn't promote your fears about medicine. And so for me, I try to encapsulate that. Then when I'm having interviews and discussion with with folks and patients and clients, and the discussion is, well, no one's ever talked to me like that. And my thought is, why not? And I'm just saying,
No, no,
this was
110%.
not this the discussions around your diagnosis and the diagnosis of zillion men of color is not their discussion. The discussion is, did I ask, did I think, did I do the test, and what was I going to do when I did the test? More often than not, if you don't do the testing, you can't find out.
No,
If you're not advocating for that person to do that because of the risk of prostate cancer. And if you say to me, gee, that scares me and I don't want to do it, that's fine. But if I don't ask, that's another
I'd rather
discussion.
know, like on the front of it. Not knowing is bad. Not to wish you know is worse.
So not knowing is bad, but not to wish to know is worse. I heard that African proverb. All right, okay.
So you can wish
Uh,
not to know, but it's gonna get worse.
well,
I'd rather know so I can make a decision to save my own life.
mhm. Well, and
Cause I don't want to just I don't want to just what am I here for? I don't want to just be getting up here working and go to work, whatever. That don't mean nothing to me. I got
well,
children. If I have a wife or if I have significant others that love me, I want to be here to add value to their lives as best I can. You know, I done seen people die of cancer and they wasn't out here crying or begging nobody for nothing, but they still added value to my life while they were still here. My mother,
Yeah.
other people. So
Well, I think too is that the sense of family and of um, connectedness and understanding and love that was interrupted by us. We've done this in spite of the interruption, in spite of the degradation, in spite of the lack of resources. And so it's really kind of interesting to hear a number of groups talk about how they are traumatized.
yes, yes,
We are the picture postcard for being traumatized in the system, and continue so and the ultimate is more recently George Floyd's murder, and another traumatic experience happened to us again. None of the things that we're seeing and talking about, they've always happened to us. They're just it's circling in themselves, and that's why the concern about being woke, you know, and because woke says, as in prostate cancer, that you understand that this is a diabolical affliction that affects a lot more and black men that have adverse outcomes, and they could have had better outcomes if for education.
110%. And if you have a willing friend to go to the doctor with you, don't want to sit up here and drink a beer with me. You know what I'm saying? Go listen to me like, hey, bro, you need to, did you take your medicine today? Are you, we're not eating that.
Mm-hmm.
I'm gonna be here with you. I'm gonna do the same thing you're doing. You know what I'm saying? So we gotta have people that's in our lives that's willing to kick in that love, and we gotta be willing to follow
Well,
through.
yeah, and it's kind of interesting too is that as I think about what you're saying, the men most closest to my father were the men that did the most stuff, and they were all just that was it was they were, I'd say like they were like Dean Martin's pack rat, So that's the other piece that gets involved in this is that interconnectedness of men with men and how seldom we are, how more we are combative, how more we are um, singularity,
Yes.
and that lends itself to why we don't talk, why we don't share, why we don't conversate. Women do it all the time. They talk about everything.
But that's why
You
the
know.
men's group is very important, where we
Okay.
have a structured area, a safe area where you can talk about those type of things, and you can listen, and you can see other people open up, and you can learn how to do that in a safe place. So we
Mm-hmm.
need to have those safe places where we can have doctors like yourself and people that can to structure the conversation to go in the way we need it to go.
Yeah.
What's the topic for the night?
Yeah.
And this is what we're going to learn on. And so we
Well.
got to have those type of things. And it doesn't have to be at a church. It doesn't have to be anything. The Zoom calls is doing it. We just got to put the structure together
Yeah.
and be willing to take that hour out of our time out the day to get that mental health awareness that we need.
Here's the issue. I like to use the term provider because there's so many clinicians. Uh, the issue is that there has to be, like you have now, a laser focus toward it. And as I said before, if you're just balancing the day to days and dealing with the microaggressions and just trying to get food on the table, it's just so hard to think about yourself. I always tell a lot of my patients, I say, if you